Speaker Nancy Pelosi today ordered committee chairs to postpone their hearings. Basically, she's clearing the decks on what's seen as a final push to pass health care reform. Has she, though, reached the magic number of 216 votes, the number she needs to claim victory and move this health care reform plan through? Let's get to Indiana Congressman Mike Pence. He is chair of the Republican Conference Committee. Good to see you, Congressman. Are you working off the assumption that the Democrats will be passing something within the next week to 2 weeks?
No, I'm not working off that assumption at all. I think if the Democrats actually had the votes right now, we'd be voting right now on the floor of the Congress. I think millions of Americans are rising up. They're letting their voice be heard, and they're causing certainly not the Democratic leadership and obviously not the president to rethink this government takeover of health care. But I think they're causing a lot of those backbench Democrats who are from a lot of more conservative areas of the country, and particularly the pro-life Democrats in the Congress, to take a second thought before agreeing to vote for that monstrosity of a bill that passed the Senate on Christmas Eve.
Well, if they do indeed pass this, will you work then to repeal it?
Well, you know, Jane, I've been being asked that question over the last couple of days, and to be honest with you, I don't think they can pass the bill. And so what I'm telling folks around Indiana and around the country is, look, we're down here, we're on the 1 yard line, it's third down, we've got to hold, and I don't even think we need to be talking about after they pass it, because they don't have the votes right now. And if the American people will continue to rise up and reject this government takeover of health care with its massive tax increases and mandates and using public funds to provide coverage for elective abortions, I think we can start over and begin to work on health care reform that'll focus on cost and not government.
Though that's the reality, though, of what you have to look at. You have to look at what happens if they do pass it. There are plenty of Republicans who say, including Karl Rove, who was on with us last week and said, never count Nancy Pelosi out. This is quite possible this is going to happen. So specifically, your answer to the repeal question, would you work to repeal it?
Well, let me say, you never want to count Nancy Pelosi out. We saw the favor factory kick in to pass the climate change bill, to pass the government takeover bill itself, the failed stimulus bill. But Republicans did something very dramatic today, just about a half hour ago, Jane, that is probably going to make it a little more uncomfortable for business as usual. House Republicans just a few minutes ago voted to ban all earmarks for the rest of this Congress on all legislation. So now House Republicans are going to the American people and saying that we want a clean break from the runaway spending of the past. We're going to start over and put the American people and fiscal discipline back in the driver's seat. And that's going to be quite a contrast to the House Democrats and this administration that are no doubt getting out the promises, another Cornhusker deal, another Gatorade deal. And I think it's going to be even more difficult for them to pass this bill. I don't think they can pass it. I think the stand Republicans took today is going to create a tremendous backdrop. The American people are on to this favor factory and earmarking. And on that basis, and with the voice of the American people, we're going to bring that government takeover down.
And the White House has called today for those deals to be taken out of this deal, the health care deal. Before I let you go, Congressman, I do want to ask you.
Remember, Jane, they won't all be in the deal. Remember, they won't all be in the deal. There's earmarks, there's side deals, there's hey, if you need that bridge, we'll get that bridge and another project. But, the American people are onto this. That's why House Republicans today said we're going to renounce all earmarks in all bills for the rest of this Congress. We're going to offer the American a clean break from the runaway federal spending in both parties in the past.
Well, and
now they're looking at Democrats cutting deals to get their government takeover done. I think the American people are going to recoil from it.
And if that can pass, that's a whole other question. I really only have 30 seconds left, but I do want to ask you, I know in about 48 hours you're going to be in front of a town hall meeting in your home state of Indiana. Are you comfortable telling the people there that if this plan by Democrats for health care reform does not pass, that going forward we may be stuck with the status quo, what we have now, that most analysts will tell you is not sustainable?
Yeah, I'll tell you, Jane, what I'm going to tell people in Richmond, Indiana, and I'm going to tell people in Connersville and Newcastle, Indiana, is that job one is stop this government takeover of health care with its billions of dollars in taxes and mandates. Job two is to immediately work on the kind of step-by-step reforms that will focus on lowering the cost of health insurance without growing the size of government. We can do that. There's frankly bipartisan support Senator Ron Wyden and others support allowing people to purchase across state lines, malpractice reform. We can do all of that, but job one, the American people need to know right now, is stop this bill.
Congressman, we're going to have to leave it there. Thanks for your time.
Thank you, Jane.